What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at exercises for adductor tendinopathy, which is pain in the groin muscles. Typically, when people have tendinopathy, they'll either have pain in the tendons down where they attach on the inside of the knee or up where they attach on the inside of the groin. So if you've got pain in either of those areas or pain in the muscles on the inside of your leg in those adductor or groin muscles, then stay tuned for today's exercises. For our first exercise, we're going to start with an isometric contraction of our groin muscles. So you're going to take a ball, usually something like a volleyball or a basketball works. The one I've got here, it might be a little bit small, but what we're going to do is lie down on our back with our knees bent so that our feet are flat on the ground like you're going to do a bridge. You're going to take that ball and put it between your knees. And then this is going to be pretty straightforward. All you're going to do here is squeeze the ball with a pressure where you can feel those groin muscles working. You might feel mild discomfort in your painful area, whether it's in the muscle or the tendons. It's okay if you have mild discomfort. You're just finding that pressure, the level of pressure that you can put on the ball to, again, maybe where you feel mild discomfort and the muscles are working. And then you're gonna try to hold for 30 to 45 seconds, and we're gonna do 4 to 5 reps of this. So in the beginning of an injury like this, where you have acute pain, isometrics can help to reduce pain. So you're going to do 4 to 5 reps every day, hold for 30 seconds or so, and then relax, give it a break. And again, don't squeeze with maximum pressure if you're really acute. If you think about 100%, squeeze is full, your full potential, maybe you're starting at a 30 to 40% squeeze, something like that. Just to the point where you're sort of initiating some of the symptoms. You can feel mild symptoms, but nothing more than mild to moderate symptoms. 30-second hold, rest for 30 seconds to a minute, and then you'll go ahead and do another squeeze. You can spread these throughout the day too. If you're thinking about 4 to 5 reps, you could do 1 or 2, and then a few hours later, do another couple and just kind of spread them out throughout the day. Okay, so that's our first exercise, an adductor isometric. For the second exercise, we're going to be in the same position. We're going to take that adductor isometric and add a bridge to it. One of our adductor muscles, adductor magnus, is also a hip extensor, so it helps to move our hip into extension, which we need to come up into a bridge or get out of a chair, things like that. So what we're going to do is, again, put the ball between the knees, arms down at your sides. You're going to squeeze the ball first, that's step 1, and then do a bridge. So we're getting the adduction component, which that's the primary action of the groin muscles is hip adduction, squeezing the ball, and then hip extension is when we lift our butt and we get to this more neutral position where our femurs are in line with our torso. So keep the squeeze on the ball. For this one, you're going to go for 10 to 15 repetitions. Just go until you're tired. Try to get all the way up to where your body's straight and then back down slowly. And this will be kind of more of a traditional strengthening exercise, so we're going to go for 3 sets. Again, in that 10 to 15 repetition range, basically until you hit fatigue. And that is our second exercise, an adductor isometric with a bridge put on top. For the third exercise, we're going to use our adductor muscles in an open chain fashion, so our foot won't be hooked to the ground. A lot of you have probably seen this exercise. If my right leg is the injured side, I'm going to have that side on the ground, and then I'm going to lie all the way down on my side. My left leg can stay back behind like this. Sometimes it's easier to kind of put it across the front. And then what I'm going to do is lift up that bottom leg. So I'm using these groin muscles, these adductor muscles, to pull my hip into adduction. Adduction is when your leg moves towards the midline of your body. So I'm lifting up and down like that. Again, I'm going to go for 3 sets of 10 to 15 repetitions. You can spread the sets out throughout the day. We're basically just trying to activate that muscle, put some load on it, and build its capacity, the muscle and its tendons at either end. If leg weight gets to be really easy, then an ankle weight is a good addition to this. You could slowly ramp up, adding a couple of pounds to your leg. You don't need a ton of weight usually for this. So again, open chain hip adduction, thinking about 3 sets of 10 to 15 repetitions. For our fourth exercise, we are going to perform a sumo squat. Basically a squat with our legs out wider. This is a good way to target not only the quads and the glutes, but also our hip adductor muscles, those groin muscles. So what you're going to do is to find a dumbbell that's a good weight for you in your current healing state. I have 15 pounds here. I don't have an injured groin muscle, so this is probably too light, but just figure out what's right for you. Even just starting with body weight is probably a good place for a lot of people if the area is really irritated right now. So what you're gonna do is put your feet out a little bit wider, kind of turn your toes out. So it's gonna be, again, it's a sumo squat is a wider stance squat with a bit of external rotation where the feet are turned out. The dumbbell is gonna be right in the middle. You're gonna squat down, pick it up, and basically just go up and down like that. So we're just doing a wider stance squat. Because our legs are rotated like this, it helps to engage those hip adductors, the groin muscles. So just keep your chest up, go down, keep your head up. If the dumbbell's big enough, sometimes it's nice, you can kind of touch. If it hurts to go all the way through full range of motion, you could just do a shorter range of motion and build up to full range of motion. Again, you can do this just with body weight or even just 1 or 2 pounds if your muscles are really sore. So just find the level that's right for you, and this can be a great one again for starting to build strength in our groin muscles in a more functional way. For this one, again, go for 3 sets of 10 to 15 repetitions. You could do this every day or every other day, depending on how your body responds. Okay, so that's our 4th exercise, a sumo squat. Before I get into the last exercise, just want to mention my book is available on Amazon and Barnes & Noble. It has rehab programs for the 50 most common injuries and pain issues. So you can basically just do your own rehab at home. Every body region has its own chapter. Today we're talking about the groin muscles. In the hip chapter in my book, you'll find this groin strain program. So whether your pain is on the inside of your knee or up by the groin, the hip region, this program can help. All of the programs take you through 3 phases and have pictures of me doing the exercises. So they're more comprehensive than my YouTube videos. The YouTube videos typically just have a few exercises. The programs in the book are going to be much more like a program you'd get if you came to see me in the clinic. And again, every body region has its own chapter. So if you'd like to have a resource at home that allows you to do your own rehab, I will put a link for the book down in the description. All right, this is our last exercise and the most challenging for the hip adductor muscles. This is called the Copenhagen plank. It's been studied a lot in a bunch of different groin strain programs. It's been shown to really be effective in strengthening the groin muscles and preventing or reducing the chances that people have a secondary groin strain, especially in things like hockey players. So it's a great one if you have tendinopathy or a groin strain. You just have to, again, wait till you're ready for it. So you kind of test it as these other exercises earlier in the video are getting easier, then you can try building up to this. The first position for this is a short lever Copenhagen plank. So we're gonna put our knee or our top leg up. So the leg that's painful is the one going up on the bench. So I'm gonna bend my knee to start with. This is the easier version, it's a shorter lever arm. My bottom leg is gonna straighten out and I'm gonna lie down on my side. So I'm gonna use the groin muscles here on this top side to basically, again, do sort of like a groin, it's like a groin plank. So I'm gonna lift up the bottom leg first and then push into the bench and lift myself into a plank. So the groin muscles here, the groin muscles on the bottom leg are working too, but it's really the top leg. I'm pushing down into the bench. Those groin muscles are lifting my pelvis off the ground up into a plank position. And I'm gonna go up and down. Now in the beginning, you could just hold up here. You could just hold for as long as you can. Maybe you work up to a 30-second plank. You also can do repetitions. I kind of like doing reps sometimes, like a regular strengthening exercise, going through the full range of motion. But if you're working through this progression, you might start with the isometric and then work towards reps like this as the area heals and desensitizes. Okay, this is the easier version, the shorter lever arm to start with. The harder version is to put your leg out straight. So you can see here, this is a longer lever on my groin muscle. So the same idea, arm up, lift the bottom leg, and then lift up. Okay, so usually when you see this in research papers, they'll just have people kind of hold and do more of a plank. I do also like to do it as a repetition where I lower the pelvis back down and then lift up. But again, just start with the plank, and you might not be able to do many of these. You're just going to fatigue. You know, even right there, I hit 5 or 6 reps and my adductor muscles feel pretty tired. So you don't necessarily need to do 10 or 15 on the Copenhagen plank. It might just be an isometric hold. It might just be 3 to 6 reps. Okay, guys, those are some of the best exercises for groin strains and adductor tendinopathy, basically pain anywhere along that groin muscle region. If you have any questions, put them in the comment section and I will try to get back to you. All right, see you next time. Bye.